Guys, what should we do for our skit? It's tomorrow, right?
Yeah, I can't wait to see what we came up with. Which one of you guys was doing it again?
It wasn't me.
Not me.
Not me.
Not me.
Well, maybe the second and third years will help us out.
I don't know about that. They've already done so much for us already. Maybe we can get some ideas off the TD.
Interesting.
Within the first-year class of the WashU Ophthalmology Department, 5 contestants compete for 5 spots. There will be battles, adversity, deception, but mostly just people talking into webcams. All this and more on Survivor. Let's meet our contestants.
Hi, I'm Bliss. I'm from Texas by way of Kansas, and I'm really excited to be here. Been ready for this for a while. I'm not really sure why we're having this competition though, because I thought there were 5 spots for the 5 of us. So I don't know, but they did give us, some food tickets, so that's awesome. I guess I can eat for a while. And the other thing though is they give us these t-shirts to wear.
Hey, I'm James. I'm originally from Arizona. I went to a small school in the Northeast, and then I did my medical school at WashU. So I feel like I have a pretty decent edge over some of the competitors here. I know the ins and outs of the hospitals, the secret passageways. So I'm pretty excited about getting things started. And I think I have a good advantage over everyone.
Hey, my name is Rich from Indiana. Pretty stoked to be here. What we have here is a competition, which is kind of a joke because I'm involved in it, so it's not really going to be too close. But 4 other people here are really not worried. I've faced similar things in the past. I graduated my intern year as the only intern left. Similar type thing. Yeah, basically really excited to crush the competition. Got my man in the White House. I'm here. I think we're about ready to go.
I feel especially good going up against that simpleton from Indiana.
I'm really pretty optimistic. I think that things are going well, and I'm positive I'm going to stay here.
I'm David Attenborough, and this is Planet Earth. In the urban jungle of Barnes Jewish Hospital lives a curious creature seldom seen by most observers. The sleek and elegant ophthalmology resident on call is known for its cunning and stealth around the hospital. Equipped for agility and wearing sneakers for sneaking, the resident is able to maneuver in and out of an exam room without detection. But this was not always the case. Previous ancestors of the species were bogged down by tedious equipment. They wore dance coats, comfortable accoutrements, but clamorous and attracting much unwanted attention. She is well equipped to be sure, having ample supplies to provide sustenance for both herself and her newborn child. However, clumsy and cumbersome with all her equipment, she becomes easy prey for the curbside consult. Bombarded by dangerous predators such as the psychiatry resident requesting an emergent refraction, or the pediatrician with an eyelash caught underneath the lids. Today, the resident on call has evolved for speed and stealth. Watch as he hydrates in preparation for his next consult. And he's got one in the ED. he darts between doorways, evading detection from passers-by. With a quick sprint, he heads for the lower levels. He cleverly uses his surroundings to blend in with the other patients. An obstacle. He must elude the ED physician if he is to avoid a curbside consult for contact lens removal. With a great sigh of relief, he's made it into the patient room. As quickly as he entered, he departs, leaving the consult note as the only evidence he was ever there. Coming up, we observe the mating rituals of the retina specialist. Next, on Planet Earth. It's Frank's the darn displays.
Can you believe it's this young lady's birthday, 21? Would you sing with us, please? Would you sing with us?
Happy.
Can you believe it's my little sister's birthday here? Happy birthday.
Thank you. So sweet.
Can you believe this is Neil Armstrong's little brother? Unbelievable. Can you believe it's both of their brothers' bar mitzvah this weekend? I can't believe this guy right here. He's been in San Diego studio for the last 20 or 25 years. Been a good run.
So I just want to congratulate you on your 1-year work anniversary here. And any of these items here.
No. I was saying when this guy clogged him to let it to VA this morning.
Welcome back. The transition to ophthalmology has been easy for some, but not all of our competitors. Let's check back in to see how they're doing.
I started doing indirect ophthalmoscopy when I was 12 years old. Basically been training for this my whole life. Checking pressures, refracting, please. This is gonna be a breeze. Seriously, I think I'm about at the level of a 4-month in second year right now. Haven't even started, pretty much not worried.
That's keeping me really optimistic, really, is everyone that's in the program. They've all been really supportive, and there's a guy that keeps wishing me happy birthday, despite the fact that it's really not my birthday. He goes by Dr. Frank. I don't really know why he does that.
I haven't slept in 36 hours. I was on call all night and I had to stop with Nathan. We saw 2 whole patients.
Yeah, they put me on consults first. It's been pretty rough. Haven't seen the sun in a while. Food is a constant struggle. You know, I burned through those green tickets the first week. Now I mostly survive off Ike's supplies. You know, I get my carbs from the Almond Joys, the protein from the Swedish fish. Oh, this little thing? It's a small liberal arts program out east.
Coming up, we talk with some of the competitors from previous seasons.
Yeah, these millennials these days, you know, just complaining. Well, back in my day, when I was first year, yeah, we had 5, but only one of them was working.
Plus, conflict begins to develop between the residents.
Yeah, I have been using Timol a fair amount, actually. I find that in patients with AFib, it actually brings their heart rate down, gives them better rate control.
That Han girl puts the lull into Malal.
And unexpected alliances begin to form. This and more on Survivor.
Hello, I'm Rich Schrader. Thanks for coming down to our shop today. You'll find we have a nice selection of modern, up-to-date, and seamless equipment that we can offer your office to make your practice a dream practice.
Schrader's Discount Emporium. Not responsible for any infection, blindness, or death due to malfunctioning equipment.
Here we have our top-of-the-line S400 indirect ophthalmoscope. Created by one of the many visionaries in the mid-1950s, you'll find that this equipment is good for a number of things. Not only did we find that using a dull yellow light that can kind of get through cataracts is the ideal way to look at the posterior pole, you also find you bond with your patients more while using this piece of equipment. You'll need twice the time to examine someone, and by the time you're done, your patient will appreciate all of the hands-on examination time that you gave them. So I think you'll agree with me, wireless is for chumps.
Trader's Discount Emporium.
Now with 2 new locations in Guatemala.
You are watching KMOX TV Channel 4.
Good evening and welcome to Channel 4 News. The Epic rollout has been delayed once more due to confusion.
But we here at Channel 4 News would like to first report exclusive simulation footage of how the Epic rollout will affect workflow.
Anything's better than the VA.
Ulcer in the shape of former Yugoslavia. Papules disguised as follicles on the upper lid, but definitely not follicles. Trust me, there are no damn follicles on the upper lid. Now which font to pick so that they'll know who wrote this note? Perfect.
Damn it, Lube changed my default treatment setting to Restasis again. I'll get him back. Follicles everywhere. Follicles on the bulbar conjunctiva, the superior palpebral conjunctiva, especially on the superior palpebral conjunctiva. There's even follicles on follicles. Lubneski. Now just to reset my default treatment setting. Insert a few diagrams. Done.
Truthfully, it was just a big bubble. Relax and easy. Done. Okay, go out and enjoy the sunshine.
In other news, medical scribe is now the highest paying profession, in large part due to high demand from Dr. Lubneski.
That's right. Jenny says the darndest things with the jello.
Everything's better at Stein. This was better at Stein. This was better at Stein. Better at Stein. This was better at County. Yeah. Yeah, Stein's a lot better than this.
Back on Survivor. 2 bitter enemies form a shocking alliance.
Listen, James, I think it's time we form an alliance. I've watched previous seasons of this, I'm not gonna lie, in preparation for this year, and all the successful candidates formed alliances. There was the great Joel-Robbie connection of 2015.
The Indian retina service.
Blake Smith.
Couch Shebani.
And don't forget the Asian alliance.
Oh, the Asian alliance.
You know, I thought it was going to be a stronger coalition this year, but it's just not panning out so far.
Yeah. We're gonna have to make some decisions, bro. Personally, I thought a lot about going after Bliss at first. No, we're going after Han.
I saw what they did to Han. They took her to her medicine workroom and they just locked her in. And it was awful. It was awful. I wouldn't do that to my worst enemy. That's Rich.
Yeah, they shoved me in the medicine workroom, locked the door, and laughed for 10 minutes straight.
Coming up, the thrilling conclusion as we find out who gets voted off next.
If I could go back, I think we probably should vote off Tommy. Now I gotta be a co-fellow with him, so that kinda sucks.
I got voted off? guess I don't really know what I'm gonna do.
Plus, new strategies begin to emerge.
Figure out how I'm gonna survive. I'm just gonna lay low, let everyone else ruin themselves. Incognito.
And then this guy, who won't stop talking about where he went to undergrad.
Oh, this old thing? That's just my alma mater.
Do you like solving mysteries? Hang on to your seat, Nancy Drew, because we have the perfect piece of equipment for you. This right here is the B-scan. It's called If Found, call 362-3431, the University Eye Service, or page 360-6054, Ophthalmology Chief. Honestly, we don't know where this came from. It's been sitting in our archives for quite some time, still being used here and there across the hospital. What we offer is a beautiful piece of grainy, black and white imaging that'll cause you to wonder in the middle of the night exactly what you're looking at. Best used by 3 people at the same time to kind of debate what exactly you're seeing. We find that it'll help hone your diagnostic skills as you try and use your brain to overcome what this machine is showing you. This is really a prized piece.
Trader's Discount Emporium! Now sanctioned by the governing medical board in Chechnya.
Do you like 1 and 2? This is the Hoffer Q4 Opter. Really kind of a plain piece, but for an extra $50, we'll include an option to translate Burmese for you. The trick is getting them better than 2,200. That's impossible.
Trader's Discount Emporium! No longer associated with ocular syphilis. We fired that employee. He's becoming a glaucoma fellow.
Did you ever make anything happen? Anything you couldn't explain?
Specto Patronum.
You're a wizard, Wes.
All right, so, Bliss, tell me what this is.
Well, looks like there's a corneal laceration there with some pigmented material protruding through. Probably uvea?
No, it's mud. This guy fell on his face, got splashed, wiped off with a Q-tip. All right, Rich, let's go and we'll do the next one.
So, we're looking at a cornea. It's not clear.
Good.
Kind of like a breadcrumb appearance. I'm thinking like a granular dystrophy.
Rich, what lecture is this? This is the second week here. This is the trauma lecture, isn't it? Little rounds and shit. You think I'm going to be showing you a picture of granular dystrophy?
I thought it might be
You say
twist.
breadcrumbs? Breadcrumb appearance?
Yeah.
Here's breadcrumbs. The guy was working in a breadcrumb factory. His pneumatic hose in the breadcrumb room broke. There's breadcrumbs everywhere, including on his cornea, right there. All right, next.
All right, James, let's go over some Goldmans here. This here's one of the right eye. What do you think?
It looks okay to me. Pretty full.
Yeah, it's pretty good. Goes all the way to the middle. Not bad. Sorry, left eye. What do you think there?
I'd say this one looks okay as well.
It's pretty non-specific changes here. Let's try the last one here. This is 6 months later. What's going on here?
I'd say this definitely looks A-okay to me.
Are you sure?
I think so.
Well, like, what's your strategy when you go through these things?
I mean, it looks okay in the middle. It looks okay in that red spot there. It looks okay in the blue spot too, and okay in the purple.
Are you just reading the labels?
No.
Okay guys, let's get started. So first we have a 50-year-old female with acute onset vision loss. This is a picture of her OCT. Tell me what you guys see.
We're looking at an OCT here. You notice these not so subtle, dare I say, classic changes of the inner retina. I saw a similar case at Grand Rounds last week, and I don't mean to show off, but I think we're looking at a classic case of PAM.
Rich, that's a great guess, but this is actually APP-AWAMN. That's acute pigmented paracentral acute middle macular atrophy associated with a neuroretinopathy. It's a newly described entity, but we do think it's quite distinct from AMN and PAM.
Coming up next week on Survivor.
What's up in the next round?
Plastics, bro.
On to neuro.
Watch out, cornea. Here I come.
Nephrology?
No one told you life was gonna be this way. Your job's a joke you broke.